All right, so here's the sitting test. I'll talk about alignment, and then we'll talk about just kind of the extending the knee and dorsiflexion of the ankle. Okay, so for the alignment, I'm going to kind of get out of the way, but I want you to look kind of at the lumbar spine and the hips, and then even the knee, okay? So we want her in an upright posture. We don't want excessive lordosis. The lumbar spine probably is going to be flat here versus excessively lordotic. So you can see she's a little bit lordotic, but obviously has a child that's due in March, pulling her forward a little bit, causing more of a lordosis. But we want a flat spine there. And then we want 90 degrees of hip flexion. And then in a relaxed position, it should be about 90 degrees of knee flexion. Okay, so that's just the static posture. So now I'm going to have her extend her knee and dorsiflex her ankle. So you can either do it separately where she extends her knee and then dorsiflex, or she can dorsiflex and then extend her knee, or just kind of do them simultaneously. So what we're looking for is, I'm just going to have you straighten your knee and then bring your toe up. So we want the knee to at least get to 10 degrees from full extension. So she's fully extended, but it can be flexed about 10 degrees, and that's still good. The ankle needs to be in 10 degrees of dorsiflexion, which I'm not sure how well you can see that, but she's not getting 10 degrees here. This is neutral, that's 0, right? So she's not even at neutral. There she went further, so that's probably a little closer. I still think she's shy there. So knee fully extended, ankle shy of 10 degrees, which tells us when the knee extends and we dorsiflex that the gastrocnemius is probably tight, restricting that motion. Now it still could be maybe a joint problem, and you could do some different biomechanical testing to test that, but sometimes it's pretty easy just to have her flex her knee, dorsiflex. If she gets way further than 10 degrees, we can confirm that the gastrocs were tight or stiff, limiting her motion here. Okay? So that's just like the knee extension, ankle dorsiflexion test that we're looking for. Again, the degrees and the normal that you want to see is the lumbar spine being flat, hip flexion at 90 degrees. In a relaxed position, the knee is just comfortably sitting there. And then as she extends, she can come to within 10 degrees of full extension. And then we want 10 degrees of ankle dorsiflexion, which she gets it there as her knees bent a little bit more. Okay? So that's what we're looking for. One more thing though. If you're watching, can I have you face the camera? If you're watching her extend, I just want you to watch this real quick, but if she extends this knee, and you see the tibia rotate medially with knee extension, that could tell us that the medial hamstrings are stiff, pulling on the tibia to cause it to rotate medially. Or vice versa, if she extends and it laterally rotates at the tibia, the lateral hamstrings could be pulling the knee into a lateral rotation. So again, hamstrings could be a problem in this position as well. So that is the knee extension ankle dorsiflexion test.